Is Ava Cotliar, and I am a class of 2020 social work student. The title of my presentation is Using the Internet to Explore Anxiety, Depression, and Trauma Experiences Among Females with Eating Disorders. This research project is in honor of Nancy Lou Mescon, the daughter of Enid and Michael Mescon, and who lost her life to this disease. Thank you for taking the time to view my presentation. Defined by the Mayo Clinic, eating disorders are serious conditions related to persistent eating behaviors that negatively impact your health, your emotions, and your ability to function in important areas of life. The most common eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. Basically, while unhealthy eating habits are widespread within our society, eating disorders get in the way of somebody's everyday life function, such as their physical, mental, and/or emotional health. Eating disorders have the highest mortality rate of any mental illness. That is a shocking statistic that society cannot ignore. Eating disorders are a dangerous disease that slowly kills, wreaking havoc on the human body. Nearly half of eating disorder patients have a comorbid mood disorder, such as depression or anxiety. This tells us that millions are living with eating disorders along with a mood disorder, often suffering in silence. While the exact cause of eating disorders is not fully understood, research suggests a combination of genetic, biological, behavioral, physiological, psychological, and social factors can raise a person's risk. Adolescent females are the most at-risk population for developing eating disorders. Young females endure pressures from society, the family, and themselves on a day-to-day basis. According to the National Institute of Mental Health, the prevalence of suicide attempts in 2017 was highest among adults aged 18 to 25. Adolescents and young adults are not receiving the help they need, and the reality is many die as a result. Show that the most common eating disorders coexist with at least one additional mental health disorder. This information tells us that eating disorders need to be screened for alongside traditional assessment tools. Evidence has shown us that eating disorders have the highest mortality rate of all mental illnesses, so the earlier the intervention, the better. Through studying the prevalence of coexisting conditions such as depression, anxiety, and childhood trauma in patients with eating disorders, my aim was to further understand how to treat eating disorders as well as locate at-risk individuals. Disordered eating is a complex condition with many factors that contribute to the problem. Understanding the comorbidity of mood disorders would allow for us to implement preventative measures as soon as possible. By studying this population, I hope to better understand mental health and the need for research and interventions. This project would also help lay the foundation for further research and advocacy for myself and the larger community. For the research design, I created a three-part survey that included the Patient Health Questionnaire, or PHQ-9, to screen for depression, the Hamilton Anxiety Rating Scale, or HAM-A, and the Adverse Childhood Experiences Questionnaire, ACEs, for childhood trauma. These are all established and commonly used screening tools by mental health professionals. I contacted friends, professionals, and social media platforms to participate in this survey. All answers were self-reported, anonymous, and completely voluntary. The sampling pool was much larger than I expected, with 319 participants. I was aiming for somewhere between 25 to 50 participants initially. The internet turned out to be a highly effective mechanism for reaching people throughout America and even internationally, with respondents from Europe, the Middle East, and Asia. Ages ranged from 13 to 55 years old. Many participants also identified as queer LGBTQIA+. My main source of feedback came from the website Reddit, with over 90% of participants from various subreddits such as eating disorders, body acceptance, sample size, and more. Over 88% of females with eating disorders reported a history of depression within the last 2 weeks. This tells us that depression is prevalent amongst eating disorder patients. Such staggering numbers are difficult to argue with and should interest anyone, especially those within the behavioral health or public health fields. 85% of females with eating disorders reported a history of anxiety within the last 2 weeks. Again, such high numbers cannot be ignored. If this survey only reached 319 individuals with eating disorders, imagine the numbers throughout America and the world. The ACEs score showed us the correlation between childhood sexual abuse or sexual interaction and eating disorders. There is much research on the relationship between sexual abuse and eating disorders, and results vary due to the lack of consistent measurements used and definitions of sexual abuse and eating disorders. This is a self-reported study, and if 29% of people claim to have had a sexually abusive experience, I believe it is valuable and should be taken seriously. Of behavioral health disorders as comorbid with eating disorders are worrisome, especially since eating disorders are such a deadly disease. It is important to remember that eating disorders are not a lifestyle choice. They are biologically influenced medical illnesses. The knowledge from this study and others like it can, however, be greatly beneficial to us because the more we know about the disease, the more effective treatment can be. Of responses received from the internet gave me insight to the benefits of the internet and technology in reaching the eating disorder community. It seemed the anonymity and privacy of the internet was more appealing to this community than in-person requests. This could be due to the secretive nature of the disease and stigma around it. The convenience of the internet is also noteworthy. People can sit in the comfort of their homes at any time of day and have the freedom of choice and self-will to begin looking for support. Of the internet. It was previously covered that studies have shown low percentages of people with eating disorders receive social support and treatment. Utilizing the internet to reach these at-risk individuals is the first step in helping them. If the internet can provide at-home screening tools and endless eating disorder resources from educational information, treatment options, and virtual support. Telehealth can be defined as the use of electronic information and telecommunication technologies to support long-distance clinical healthcare, patient and professional health-related education, public health, and health administration. This includes technologies like video conferencing, email, streaming media, live chat, and more. Telehealth allows for certain people to receive treatment that may not otherwise. It may not be ideal for some, but it works for others and is better than nothing. Connection is still made, support is given, and treatment plans can be developed. Psychiatrists can also prescribe medicine for hard-to-reach patients. The ease of telehealth is inarguable, and some patients need that accessibility. Teenagers today were born into the age of fast-paced technology. They understand the internet, and many are constantly browsing social media platforms. This provides us with a means to reach adolescents and young adults in their comfort zone. The internet also shows to be a space for peer support amongst people with eating disorders. Websites from Facebook, YouTube, Reddit, and Instagram all have recovery communities that connect and support one another in their efforts to recover from various eating disorders. Disadvantages of the internet. There is no question that the internet is not the same as in-person contact. The benefits from support groups and in-person treatment are highly researched. Results may vary, but recovery has been shown using traditional methods of eating disorder treatments. The internet also poses confidentiality and privacy concerns. Unless both parties are using encrypted methods for communication, there is no guarantee of privacy. Even though HIPAA requires healthcare professionals to use a high level of cybersecurity on their devices, many private practices and public do not know enough about technology to do this. So the internet can only reach those willing and able to use it. This obstacle is the same for in-person treatment, though. Not everyone will seek treatment just because it is recommended. Telehealth and the use of internet to reach the eating disorder community needs continued research. Another disadvantage to the shift in internet use is the inaccessibility to certain populations that do not have reliable internet access or are uncultured in using technology. Those without experience in technology, such as older demographics and low-income populations, are shown to be less savvy with technology. While they can be taught how to use technology, some people simply do not have the financial means or stability to regularly access the internet. Websites and technology devices are rarely accessible to people with various disabilities. Websites, applications, and social media platforms need to be made readily accessible to cross disabilities. Unfortunately, not everyone thinks about doing this when developing a chic online interface. Considering all the factors we have discussed, it can be concluded that the internet breaks down barriers, reaching people who may not engage personally. It fills gaps in mental health care by providing a space for those who may need help but otherwise don't receive it. The internet is ever growing and changing, which gives healthcare workers flexibility and allows for opportunities. The use of internet is already widespread and healthcare workers are going to have to adapt. That means we need to proceed with care, finding the latest research on telehealth and staying informed on laws and ethical obligations. When done thoroughly and mindfully, the internet can be a vital tool for all. Thank you so much for taking the time to watch my presentation. I appreciate everyone at Georgia State, and I hope everyone stays safe during this pandemic.